A friend of mine did a kind of sexually transmitted infection education thing at his clinic, and he had his teenager staple the condoms to the backboard thing, and clearly his teenager had failed sex ed, but and they were all despondent, and this is like the worst thing that could happen. Of course, it turned into their best session. Everybody wanted some of these to take home with them, and hopefully not to use. But the point being that the signpost to failure and success is pointing the same way, I think. And I think that's true. You know, I think it's true with our kids, and like we're very failure averse these days. We're very you know, we're kind of going ahead of them, making sure they always succeed. And I think that's so true in medicine. When you go to MBA stuff, there's all sorts of failure stories, and we don't talk about our failures so much. Eric was just talking last night about a big trial they just published. There was a negative trial. And when you look at so much of medical literature and what they call force plot, you actually see that the negative trials aren't published. And we have to get much better at talking about failure. And one of the programs kind of interesting that I'm very peripherally involved with is now sort of dying as 90-day program. So that's when we take a clinical problem, not necessarily experts. We have 90 days to build a solution, drop into practice, and measure it. And so the failure rate of that is like 60%. And the best lesson there is, of course, after 90 days, how many of us have been involved on like these 2 or 3 year things? But once we do it in 90 days, we actually figure out quite quickly, you know, okay, this is what works. And when you fail, you're like, okay, it wasn't, you know, nurse facing, or the metrics were too crazy, or whatever it was. So thinking a little bit about putting a time frame around it. The other sort of interesting thing is minimum viable product, and sort of working initially with early adopters. The other approach is our hospital takes care of a lot of vulnerable populations, and we kind of flip it. So we just focus on for the non-smartphone crowd or what have you. So, but most of the stuff we're doing, we're just putting it out there. Like with 23.5 hours, I did a series of hockey cards that explained medications, and they were a total and absolute failure with the seniors that thought they were too kind of jokey. The teenagers with asthma loved them. And then we did the illustrator and I did a comic book for low literacy people with prediabetes. And then I said, hey, can you, while I'm talking, can you just illustrate my talk? And she said, sure. And that became 23.5 hours. So do you see what I'm saying? It's sort of failure, base hit, home run. And so our motto in our lab is We Suck Less Incorporated. So maybe think a little bit about that when you're running your next interventions.